Healthcare continues to take center stage in Washington as Senate leaders work to combine healthcare measures that have come out of committees. Many Americans are awaiting that outcome.
They're also thinking a lot about H1N1, and joining us this morning via satellite to talk about both is New Mexico Senator Jeff Bingaman. Good morning, Senator. Thanks so much for joining us. I guess our first question would be, what is the government's preparation in terms of H1N1?
Well, I think the preparation's been pretty good. The vaccine is getting out around the country. I think the best source of information on the specifics is this website that they've set up that's called flu.gov, FLU.gov. People can log on to that and see precisely where the flu vaccine's available. But I think the preparations have been pretty impressive so far.
All right, let's move on to health care and health care reform. Of course, it has passed one committee, your committee, the Senate, one of the committees you're on, the Senate Finance Committee. You voted for it. So now we get everybody together behind closed doors. Can a bill come out of that you can live with and the rest of the Senate?
Well, I certainly hope so, and I think so. I voted for both of the bills that are now going to be reconciled and merged together, since I'm on both the Health and Education Committee and the Finance Committee. And I think the two bills together have a lot of very important policy initiatives in there to reform the health care system, the insurance system that we've got, to reform the payment system under Medicare, to expand coverage to folks that don't have it, and to set up systems or exchanges in each state so that people can actually do a better job of shopping and getting good value for the dollars they have to spend on health care insurance.
One of the big sticking points has been the public option. Where does that stand?
Well, that's one of the key issues that has to be resolved. One of the bills that is being considered contains a public option, which I voted for. The other bill does not contain a public option. And Senator Reid's going to have to decide which course to take in the bill that he finally brings to the floor. Regardless of what he chooses to do, I'm sure there'll be an effort on the Senate floor to add the public option if it's not in the bill that he brings to the floor, or to delete the public option if it is in the bill that he brings to the floor.
Senator Reid would like a vote by the end of this month. And in that Senate Finance Committee, one Republican went along. That was Snow of Maine. Can you get more Republicans to say this is a good idea eventually?
I hope we can. I think Senator Snow's colleague from Maine, Susan Collins, also said yesterday that she was open to the idea of supporting this legislation. She needed to know more details and see the final version, but I hope we can get 4 or 5 Republicans to agree to support this bill before we complete action on it in the Senate.
We're going to move on to the Dow. A big day yesterday. Big 10K was the mark that was hit, but a lot of frustration today because some of the big winners were some of these banks that we bailed out.
Yeah, you're asking for my opinion on that?
Yes, I am.
I think the frustration is justified. There's no question that if these banks are doing as well as they appear to be doing, they ought to be paying back the funds that they were provided through this TARP legislation that was passed. So I hope the federal government will put pressure on them. I hope the Treasury Department and the Federal Reserve will put pressure on them to pay those funds back as soon as possible.
A lot of good information this morning. Senator Bingaman, thank you so much for visiting with us. We really appreciate it.
Good talking to you.
All right. Thanks again.